Welcome to the introductory training video for the PAUSE ER study, Perioperative Anticoagulant Use for Surgery Evaluation, Emergency Registry. This study is conducted by Dr. Deborah Siegel, a hematologist at the Ottawa Hospital, co-PI James Duquetis at St. Joseph's Healthcare, Hamilton and McMaster University. This study involves enrolling patients receiving a vitamin K antagonist or a direct oral anticoagulant that require an urgent or emergency surgery procedure. This is a prospective study. So why are we doing the study? There's limited data about urgent surgery in anticoagulated patients. Most studies focusing on perioperative management of patients having elective surgeries. However, there is about 3 to 5% of people on long-term anticoagulant therapy that will need an urgent surgery. Few studies to our knowledge have focused on adverse outcomes in an urgent emergency perioperative setting among anticoagulant patients. As you can see from this table, the vitamin K antagonists treated patient rates of thromboembolism, major bleeding, and mortality are 10%, 23%, and 3%. Similarly, for DOAC rates of thromboembolism, major bleeding, and mortality is 7%, 18%, and 1%. By comparison, rates for outcomes of DOAC and vitamin K treated patients who need elective surgery are 0.5 to 1% for thromboembolism, 1 to 3% for major bleeding, and less than 0.5% for mortality. PAUSE ER study objectives are to determine the frequency of adverse events, thrombosis, major bleeding, and mortality, to identify and compare determinants of adverse events, and to describe and compare anticoagulant reversal strategies and resource utilization. This is a prospective cohort study conducted in Canada, US, and Europe. It involves recruiting adults that are on a vitamin K antagonist or a DOAC for any indication, planned surgery or procedure within 72 hours or deemed urgent by the PI. Written consent during hospitalization, including a phone call follow-up at 30 days. The primary outcome is a 30-day incidence of thrombosis, arterial and venous, major bleeding, and mortality. The secondary outcomes are utilization of homeostatic agents, specific reversal agents, and blood products. This is a convenient sample size, and 200 patients are to be recruited in the DOAC arm and the vitamin K antagonist arm, for a total of 400 patients. Inclusion criteria of the patient receiving a DOAC include those on dabigatran, rivaroxaban, apixaban, or edoxaban, or a vitamin K antagonist, warfarin, fenprocamon, acenocumaril for any indication, and requiring an urgent surgery or invasive procedure for which an anticoagulant interruption is required. The surgery or invasive procedure, as said, is planned to occur within 72 hours of the decision or deemed urgent by the PI. The patient or delegate is willing and able to give informed consent during hospitalization and agree to the telephone follow-up at 30 days. In regions, provinces, or states where obtaining consent severely impacts the ability to recruit, during the recruitment period of the study, a local research ethics has waived obtaining written or verbal consent. Data collected at 30 days from eligible patients' medical records can be included in the study. So this is our study flow. A patient on vitamin K antagonist or DOAC for any indication, planned surgery or invasive procedure, obtaining consent, or retrospective chart extraction during the recruitment period for those few places that it's prohibitive to enroll anyone under if consent is needed and local ethics approves, and outcomes at 30 days. Our sites participating are those in Canada, those overseas, including Greece, and we are still looking for sites. This is online data collection using a research electronic data capture system called REDCap and managed by the Master Center for Transfusion Research Center. The timeline is from 2019 to 2021. Unfortunately, our recruitment in 2020 was severely impacted by COVID. It was put on hold, and we're playing catch up now. So let's go. Thank you.